Hi, this is Jessica DeMassa, and that's Matthew Holt, and welcome to this episode of Health in 2.0, where we answer all of your burning questions about health and technology in just 2 minutes. All right, Matthew, do you have that timer ready? We have a bunch of news to get through here.
What happened? Did we do like nothing on the beach last week? We're late.
I don't know. You're on like summer of
Where the hell are you, Jessica? Yet another new Airbnb background? I've lost track of you.
I'm in San Francisco.
I've heard of that place.
I know.
Maybe I'll see you tomorrow night at some drinking party that might be going on.
I don't know. We'll see.
All right. 2 minutes?
All right, here we go. 2 minutes on the clock. Let's go. All right, I hear you have super secret scoopy news on Athena Health that I missed. So tell me what's going on.
Okay, I nearly missed it, but Jane Starson can't help think of my sister from another mother found it. Apparently there's a bidding war going on between United, Optum, and two private equity groups, as well as Elliott, the private equity group that already put the war, but the stock price has gone down from about 160 to about 150. Who knows? It's kind of odd, but they can't find one of the big tech giants to buy, which I thought was what Elliott wanted, like Salesforce or someone. So it'll get sold. My guess is 150 a share is probably as much as they'll get, maybe a bit more.
We'll see. I hold stock. All right. How about this news from Amazon that's kind of like not news to me? They're opening primary care clinics. Didn't Apple just announce this? Why do we care?
Well, you don't care. That's obvious. But maybe we should care, because if they can put together the primary care bit with the chronic care management in the home, maybe secret understanding and rerouting the whole healthcare system. Maybe. I
don't know. I feel like we've heard this all before from other people, but we'll see if they fare any better. All right. And then what about natural cycles? FDA approved this contraceptive app. What is this?
So this is the Catholic rhythm method, but with some temperature monitoring, to tell you that they started out with like, when could you get pregnant? And they've done the inverse and gone, okay, here are the days you might get pregnant if you're trying not to. And it worked with 98% about the same as the pill when people used it. But in reality, it worked for like 93% because there were times when people knew they shouldn't have sex, but they still did it anyway. And apparently human beings are like that. They're not always as well behaved as they should be, I hear.
All right, what about
it doesn't have a drug side effect, and FDA is now approving it for its marketing program, so not a bad idea. We'll see if it works for some people.
And what about this Blue Button Developer Conference? Apparently in this like unscheduled session, all these tech giants get on stage and pledge to end interoperability barriers. So it was like Google, Amazon, IBM, Oracle, Salesforce, a whole bunch of people got up there and said this. Is this a big deal?
That's the last question. I didn't even know that had happened, but it was the Blue Button Developer Conference today. A lot of people are now building. Mark Streamersher, who's kind of the guy, the crazy Brit running the Blue Button 2.0 version there, and told me that there were, I think, 700 companies building on the new platform, and a bunch of this conference. And it was very, very hot in DC this weekend. There was like this weird right-wing, Unite the Right fascist rally, which only 25 people showed up for. And then there was like, who the hell knows what goes on in the heat, humid, muggy craziness.
Okay, follow-up question on this Blue Button thing. So have these like tech giants ever been on stage before and said anything like this, to your knowledge? I mean, you follow this along. Have they done this before?
I don't think they've all been staged together and said that together, but lots of people said lots of encouraging things, and the reality is when it comes down to it, not that much happens, and most of them are going to go the big tech giants are going to go work with the current incumbents who don't want to care about interoperability, but maybe. Things are better in that phase, but they're not good by any means yet.
Right. Hence, like,
wasn't that a double up of the question? Weren't you breaking the rules?
No, it's a follow-up. You got lost in talking about the weather in DC and some left-wing things, so I pulled you back in.
Right.
But yeah, last time I do that. Sorry.
Okay, fair enough.
Okay, so I do want to say, though, for everybody who's watching us, that we need to celebrate the Healthcare Blog's 15th anniversary. Congratulations, Matthew, on 15 years, and to all of the contributors to the blog, congratulations on 15 years. That's a crazy amount of time to be covering this space.
15 years of general insanity, and I am actually running a whole bunch of articles there of sort of the greatest hits from like 10, 12, 15 years ago, so this will go up in the middle of all that.
Fantastic. We'll talk more about this in our next episode this week. In the meantime, if you have any questions about what it's been like to cover health tech for 15 long years on a blog, feel free to tweet them to Mr. Holt at BoltyBoy. And if you have any other questions that you'd like us to address, speaking of, if you have any other questions you'd like us to address, you can tweet them to me at Jess Damasa. Thank you guys for joining us this episode of Health in 2.00. Thanks so much.